This content was made available and assessed by our Doachelor, Arthur to ensure any privacy or HIPAA violations are not occurred.
Tonight, on the emotional season finale of The Doachelor.
Arthur Ithmia faces the biggest decision of his life.
I came here looking for the perfect anticoagulant, but now I have two medications that want to help me, and it's bittersweet because they're both great options for me. And I don't know how I'm going to handle this.
What will Arthur do now? Will he choose Eliapixaban?
Or will he choose Zara Rivaroxaban?
I never expected this to be so difficult.
Find out tonight on this episode of The Doachelor.
Hello, and welcome to the shocking finale of The Doachelor. I'm your co-host, Hugh Heffriff.
And I'm your other co-host, Audrey Hepburn. This is the moment you've all been waiting for.
Our Doachelor, Arthur Ithmia, would choose between two Doacs as his search for his dream medication will come to an end.
We've all witnessed his journey together, watching the drama unfold. Now let's meet our Doachelor.
Hi, my name is Arthur Ithmia, and I'm looking for the perfect anticoagulant. I don't know what's going to happen choosing between these two amazing medications. I feel like the luckiest man in the world. I came here looking for the one, and I think I'm going to find it here.
Last year, a heartthrob was diagnosed with atrial fibrillation, which prompted him to become our Doachelor this season. His symptoms included chest pain at rest, fatigue, dyspnea, and syncope. He's moved all over the country and has lived in Charleston, South Carolina, and Nashville, Tennessee. Yeehaw! But now he's right here in Pittsburgh, PA, coaching for the Penguins hockey team. What a Chad!
Speaking of Chads, he has other coexisting conditions, including diabetes and hypertension, which are under control with his current medications, rounding out his Chad's Tavas score at 2. For fun, he enjoys obstructive sleep apnea, recreational smoking, drinking alcohol, and occasionally meeting up with other medication. But he's finally ready to settle down and reduce his clotting risk.
Now, for the most dramatic season finale to date. Let's recap what's happened so far. Last week, fan favorite Jan Warfrin was sent home.
I can't help but wonder what he sees in those two that he doesn't see in me. I'm sorry.
It was indubitably heartbreaking for all of us to see her go. But tonight, Arthur must choose between his final two medications.
My name is Eliapixaban, and my dose is a 5 mg tablet twice daily for AFib. Since 2012, I have been preventing clots in patients with non-valvular AFib and after orthopedic surgery, as well as treating pulmonary embolism and treating deep vein thrombosis, while also preventing recurrence. My dose may have to be lowered to 2.5 mg if Arthur's over 80, under 60 kilograms, or has a serum creatinine level over 1.5 mg per deciliter. But I think that just shows my commitment to him. I have major beef with carbamazepine, ketoconazole, ritonavir, St. John's wort, amiodarone, verapamil, cyclosporin, erythromycin, and come to think of it, I beef with most of the CYP3A4 and PGP inhibitors and inducers. But I knew from the moment I saw Arthur that we were meant to be.
My name is Zara Rivaroxaban, and I am a 20 mg tablet taken once daily for AFib. I have been preventing clots in patients with non-valvular AFib, preventing and treating deep vein thrombosis and pulmonary embolisms, and reducing the risk of major cardiovascular events like CAD and PAD since 2011. I come in 4 different strengths, 2.5, 10, 15, and 20 milligrams, to suit whatever your need may be. My 20 milligram tablet is very curvy and cannot be cut by any old man. I would say I'm very friendly because I get along with many, except for the occasional anticoagulants and CYP3A inhibitors and inducers. I don't like to cause trouble unless I cause bleeding and 5% of haters. I know I would be the right choice for a man like Arthur Ithmia.
Arthur has one final day with a medication before a decision has to be made. Which medication will he choose?
I'm so happy that you chose me for the last date. I'll have some Krav Maga juice, please. I'll be more bioavailable.
The same for me, please.
I'm an easygoing medication, Arthur. I'm only dosed once daily, so you don't have to worry about forgetting me. Ellie needs to be with you twice daily.
That's psychotic. I have a life of my own, and I don't want to have to worry about taking my medications any more than I have to.
I know you're torn between Ellie and I, but you can't take both of us. I don't even know what you see in her. I'm so much more popular than Ellie. All the doctors are lining up to prescribe me.
I feel confident in my relationship with Zara Rivaroxaban after our discussion. She will ensure that I have good adherence.
Can I steal him away for a second?
What is it?
I need to talk to you.
What? What's wrong?
Why did you choose Zara and not me for our final date? You have to give me a sign that I should stay.
I know, and I think I'm ready to do that now. You know that last year I was diagnosed with AFib, but that's not the full story. My ex-medication was Doachelor. We split up because she wasn't right for me.
I'm sorry.
It took me months to finally see her for what she was. She targeted factor 2A thrombin, but I falsely assumed that Doax targeted factor 10A. One day, she caused me to hemorrhage, and I spent time in the hospital, which ultimately led to our discontinuation. Thank goodness for Dr. Idarosizumab. He was able to reverse the Bigatran's effects. I want to be together, but something is stopping me from choosing. I just have to know that you're different.
I promise I'm not like dabigatran, rivaroxaban, or warfarin. My bleeding risk is only 3.3% compared to warfarin's 6%, or rivaroxaban's 5%. On top of that, a study found my rate of hemorrhagic stroke was 49% lower compared to warfarin, and my rate of ischemic or uncertain type of stroke was 8% lower than warfarin's with me. I won't let you bleed. Trust me.
I simply cannot stand bleeding out, and I think she understood that. In past non-valvular AFib trials, eliapixaban was superior in reducing risk of stroke and systemic embolism, which I think is what I need right now.
I have a lot to think about, but I'm glad he shared that with me. I feel like we're closer now than ever before.
I don't understand why Ellie thinks she can just interrupt her date like that. She thinks she's so much better than me because she has a lower rate of ischemic stroke, systemic embolism, and bleeding in AFib treatment. I heard that if she's dosed too low, she has 10 times higher chance of death.
Sorry about that.
It's okay, it's okay. Can I steal him away for a second?
Jan, what are you doing here? You were eliminated.
It's only gonna take a second. Arthur,
Cut the cameras. What's wrong?
I just came to ask you why I was eliminated.
There's just too much baggage with you, Jan. Most trials show that your risk for major bleeding is greater than eliapixaban's or rivaroxaban's.
What is so bad about bleeding? These DOACs still carry a risk. There's a study that shows that DOACs have an increased risk of gastrointestinal bleeding compared to me.
Jan, it's not about the bleeding. Look at these bruises. That's from you. I can't do the hospital trips, the INR appointments, or the constant monitoring anymore. And not to mention, you also never let me change up my leafy green diet when we're together. The other two medications allow me more freedom.
I would never do anything to hurt you. And you know that I'll still be there for you if you ever need a mechanical heart valve. I know that's something that the DOACs can't promise you. And you'll regret breaking up with them prematurely because they can cause thrombosis.
I just can't get past your higher risk of ischemic and hemorrhagic stroke, as well as the higher risk of mortality compared to the other medications out there, both of which I can really see myself with long term. That's why I had to let you go, Jan. I'm sorry. Let me walk you out. After seeing Jan Warfarin again, I know I made the right choice in keeping eliapixaban and rivaroxaban here. But I must say, Jan was a cheap date with my insurance. The other two have less side effects, don't require monitoring, and have proven to be more effective in clinical trials. Ellie has the lowest bleeding risk and has been proven to be most cost effective. But Zara is dosed conveniently at only once a day and is still a solid choice. This is going to be a tough decision.
Our Doachelor is about to get on one knee and ask the drug he wants to be with to leave the pharmacy with him. Can you guess who that will be?